And the past few years have shined a national spotlight on mental health. The news media have also been a strong advocate in making sure people know how to find the resources they need. But sometimes too much information can be a bad thing, particularly when it comes to suicide. Newsy's Amber Strong explains.
Celebrity deaths by suicide tend to flood social media and the news.
The family of the former TLC star confirms she died by suicide.
While mental health coverage is important, doctors say the stories must be told with care in order to avoid what's known as suicide contagion.
So suicide contagion really happens when individuals are exposed to suicide or suicidal behaviors. This is often in a person's peer group, in their family, or through the media.
That exposure can lead to an increased risk in people already vulnerable to suicide.
We're very bad at predicting which individuals might engage in suicidal behavior after being exposed to this content. So we have to take more of a universal approach of making responsible decisions.
Young people are at a particular risk.
Teens in general are more influenced by peer models, by what they see, what they hear.
And they haven't necessarily had the experience of being through crises and knowing that it does get better and you can get through the other side.
Doctors say people contemplating suicide may be thinking more in the abstract, that they don't want to live but don't have active plans to die. But when they see or hear too many details of a suicide in a news report or on a film, that abstract thinking can become more concrete.
It's called the Werther effect. The Department of Health and Human Services says reporting on suicide should avoid repetition, details on the method, and presenting suicide in an oversimplified manner or as an answer to a problem, like this person was bullied so they took their own life. Media should also offer resources on finding help. That last point is important due to the Papageno effect, the opposite of the Werther effect, where good information could lead to better outcomes.
But I don't wanna cry, I don't wanna cry anymore. I wanna feel alive, I don't even wanna die anymore.
When rapper Logic released the song titled 1-800-273-8255, which is the National Suicide Prevention Hotline, calls to the hotline increased.
So the calls went up, suicide went down. You can't establish an absolute causal relationship, but it was very encouraging.
Because doctors say words can be powerful, and the way they're used could save a life.
The language definitely matters. How much is shared definitely matters. How it is organized definitely matters. And what happens in the aftermath of a suicide definitely matters. If you are contemplating suicide, there is help available. You can start by calling the National Suicide Prevention Hotline. That number is 1-800-273-TALK. Amber Strong, Newsy in Washington.
And if you or someone you know is experiencing a mental health crisis right now or at any time, we want to remind you that the Kern County Hispanic Chamber of Commerce has a free community helpline in both English and Spanish. So grab a pen and write this info down. It's available Monday through Friday from 9 a.m. to 6 p.m. The number is listed there on your screen at 661-525-5900.